Hi again. So we're gonna wait for Dr. UV until he joins back. I hope my internet is working fine. Like, if someone's watching, can you please tell me if my internet is working fine and if I'm audible? That would be a great help. Hello, hi everyone, hi. Guys, is my voice, clearly audible to you all? All good. Okay, so Yash says it's all good. So now I'm gonna invite Dr. UV. Hopefully this works. Okay, and if it doesn't work, it's his net. I'm really looking forward to have this conversation with him because it's going to be very interesting, especially for all the adolescents who have joined us here. Okay, so Dr. UV, can you please join us? I've sent him the invite and let us just wait for him to... Okay, I'm not going to read out the comments because this video has to go on the feed. Okay, Dr. UV has sent the request. Dr. UV, I can't see your request. I have actually sent you a request as well. Okay, wait, let me send you a request and you accept it, alright? Let us try this. It's showing Dr. UV is unable to join. Yeah, this live will come on IGTV, don't worry about that. Doctor, I think maybe you should try changing the network. If you're on Wi-Fi, try changing it to the data one because it's not working. Sonia, if you're here, can you tell me what should I... Okay, finally.
नहीं होता है.
Yeah.
This is, if we are waiting for something to happen for a long time and we have been planning it, this is bound to happen. So it's a good omen.
Yeah. Okay, so for all our viewers, I'm going to introduce Dr. UV, who is here with us today to shed light on the topic of painful sex from a perspective. Dr. UV is an obstetrician and gynecologist, and his specialty is in the field of fertility. He became famous during the last wave of COVID that came on our country, and I am glad that he went viral because he has helped busting so many myths around COVID, and it has definitely helped a lot of people in our country. And he's definitely headed to India. So we're glad to be having this conversation with the doctor. And thank you so much for joining us for the live session. And I might now, should I begin asking you the questions, or do you want to say something?
Yeah. Shoot. Yes.
Yeah, I have a very positive feeling that this time it won't break.
I think also because it's raining here, so maybe मेरा भी issue हो सकता है.
Fine. Okay, so the first question that I have for you is that, medically speaking, how much pain or irritation in the genitals is normal while having sex, and when should a person visit the doctor?
Yeah. So when you talk about pain during sexual intercourse, as we discussed, that pain is something that is not objective. Your pain might not be painful to me and my pain might not be painful to you. So let's get that very clear, because we don't want people... That's very important. For sex, it's more about your experience and what you're comfortable with and to what length you're comfortable with. You don't need to do anything on a fixed criteria or a fixed norm. So is it with the pain. Now, talking about that, there are certain red signs and red signals that you need to be aware about, irrespective of your subjective pain. And when we say red signal, which means there are three types of pain that usually as a gynecologist we want to evaluate. So one is this pain while penetration, So some people have this intense pain while penetration, but once the penetration happens, then they are comfortable. So that is something that might be kind of an indication of a local disorder. All right. Second is this pain wherein the initial part of sexual intercourse does not cause a lot of pain, but immediately when the thirsting, the movement kind of gets a little aggressive, that causes this immense peak of pains. All right. So that is the second pain that as gynac we would want you to get evaluated. And third is a long-lasting pain. So some people might feel a little bit of discomfort after sexual intercourse, but that discomfort kind of stays on for long and long. That is something that again is not normal. Apart from that, when some pain, even if it's a little bit of pain, is associated with other signs, for example, when it's associated every time with some kind of bleeding, which is not normal. And when I say bleeding, we're not talking about your first encounter. We're talking about your regular sexual life. Every time you try to have a relationship or sexual intercourse and you bleed profusely, obviously that's not wrong. I mean, that's not right. That something is wrong. And even if it's some kind of spotting every time you bleed, that means either there's a lot of dryness or whatever. So you need to get it tested. Second is when it's associated with a lot of irritation, kind of a lot of burning in and around, your vulval area, your vaginal area. That is again a sign of dryness, infection, a lot of things. So these are the few pains that are that would warrant you going to a gynecologist. And this is when we're talking about menstruators and we're talking about people with vagina and uteruses. At the same time, there is an entire different pain that also accompanies the men. So if we're discussing the men, then men also have pain during sexual intercourse, which needs to sometimes be addressed. All right.
Okay.
So one is again pain which is burning and which is more of a fictional pain. So in case, some people, if you've masturbated a lot of times or you've had sex multiple amount of time, then your skin is very sensitive. So it might get, there may be abrasions, there might be small cuts, which is causing you pain. Then that is something which is an indication that, you should probably stop because it will heal itself. You might not require medications. Also, every time you have pain during erection, all right? So we know that curvatures are normal, but then there are certain things that are known as abnormal curvatures also. When acute curvatures are something that will cause you pain, one, during the erection, and second, also during the intercourse. And, the most severe form of abnormal curvature is Peyronie's disease. So again, that is one thing. Third is if someone has a very tight foreskin or phimosis, it is going to cause pain. Also pain along with discharge. Some men might have pain during intercourse, burning during intercourse, which is associated with redness around the area, pus-like discharges around the area, then it is definitely a sign of infection. So not only are you going to have that pain, but you're also going to pass on the infection to the female. So that is something you need to very, immediately get yourself tested.
Okay, thank you. That was quite insightful. Thank you, Doc. Okay, so my next question to you would be, getting to know your anatomy or exploring your body through self-pleasure till date has a lot of stigma and shame attached to it. So sex education indicates that before having sex, people should know about their body and their life. So, could you please tell us ways in which we can have more pleasurable sexual experiences, or that it has no harms if we
Yeah. So, all right. Again, the disclaimer here is that I'm not a sex therapist or a sex educator per se. I'm a gynecologist, and my thoughts here are a little different, which a lot of people don't like. So, when you talk about exploring your body before or making your sexual life more, enhancing your sexual life, so to speak, absolutely. We have got more education, we've got more material around it, and you should definitely try it out. We'll get to it, what you do and how you get around it. But also, I feel somewhere I want to address that there is, with this lot of boom of information, which is all right, it's perfect. There's also a lot of pressure, So, because we are hearing a lot of people say that, masturbation is all right and masturbation has these advantages. There is no harm with masturbation. But if you're not masturbating, if you don't want to, it's all right. It's a choice, right? And that is, a lot of time people don't like it when I say it. But so I'm not trying to say that it is harmful, it is a taboo, you should not do it. What I'm just trying to say is, don't put yourself that pressure of, doing all kinds of things, because now it's a new information. People are talking about masturbation, people are talking about sex toys, people are talking about exploring their bodies, and that has got, because I get these questions a lot, it has got people a lot confused. What should we do, how should we do it? It's all right, you will figure it out. Ultimately, you're going to figure it out. If you are not going to figure it out yourself, hopefully you'll get a beautiful partner and you're going to figure it out with him or her, or someone who's even non-binary. So that's all right. So coming back to your question, how do you enhance your sexual intercourse and your sexual experience by knowing what you can do? Yes, definitely. We all know how, for example, we've learned now to know that masturbation per se gives you an idea of what you like, what are going to be your pleasure points, what are going to be things that you're going to be comfortable with, what you do want to experiment. And it's not just masturbation, it is the entire self foreplay that goes on, where you're kind of exploring your body, where you're trying to hit those points in your body. Some people, so if we get very candid, some people might, some people like when you would enjoy sensitivity around ears, around neck, it could be any part of your body. How do you know that? All right. So if you're someone who's very empowered, and which is a beautiful thing, and you want to know what your body likes and what your body dislikes, then that's the best part. You can self-stimulate yourself and see what you like. So you're very clear. But I would also want to say that it's all right. You can also explore it with your partner. You can. So the best way to enhance your sexual experience is to have a good communication. Now that communication could be either with yourself, which we are talking about, or it could be with your partner. Right. And what can help you is, one, of course, is the entire act of masturbation, self-play, or, communication with your partner and exploring a lot of things around it.
Okay. Thank you, Doc. Okay. So on to the next question. Okay. So because of the unrealistic depiction of sex in porn, many people think that sex is supposed to be painful, and that until and unless you're not screaming, it is not finished. So you believe sex is not equivalent to pleasurable sex and that it shouldn't be normalized?
Yeah, so that is a very important question. And, that is something that in my daily practice also I experience a lot. In fact, I just made a reel about semen volume. Because I deal with infertility, I get so many patients who come to me thinking that they're not producing enough semen volume. And where do they get this entire idea is because of pornography and probably what they read in erotic journals or erotic novels or whatever. And so they don't, and they're so surprised when I say that, your normal ejaculate is like 1.5 ml, which is like not even one full tablespoon, So 1.5 ml of semen volume per ejaculate is a normal semen volume. And everyone is really surprised because people expect you to have like buckets and buckets full of semen every time you kind of ejaculate. So one, what I want to explain in terms of pornography is that, pornography is not at all a standard. In fact, if you want to, it might ruin your experience to, watch pornography, but if you read articles of how porn films are made, or, they're very interesting documentaries and interviews of these pornographic stars, they'll tell you how tiring and, they take pills and pills of Viagra to keep that erection on for so long. There's no human in the world who can, hopefully there might be, but it's not it's not considered normal. I mean, in a normal sense, you can't have sex for hours and hours and have an erection for hours and hours. If you're having that, then probably you should get yourself checked, because then you're having a priapism, I guess. But right. So what pornography very wrongly depicts, one is the duration, all right? Second is the emotion behind it, you know. So there are all kinds of it, you know. There are kinds of it that as you described would be screaming and howling and crying and all. Well, if that gets you excited, and if you know that's something that you love, I mean, go ahead, do it, you know. It's all in your life, and we are no one to judge, but it's not something that is necessary. You know, you don't need to cry and howl to get an orgasm, whether it's a male partner or a female. In fact, a lot of Indian families, you know, live in like a one-bedroom hall kitchen, you know, and they have sex like right where the doors and the walls are quite thin, you know. No one is shouting, but still everyone is having a good life and producing babies and everything. So one is that. Second, of course, is about the semen volume. That is something that men really need to understand. One is the duration of sex. Second is the volume of ejaculate that you're producing. It is absolutely false. And third is, of course, the force with which sexual activities sometimes are done. You know, I think that is again something that is very, very, because we're talking about pain, it becomes very relevant here, because somehow men might understand, or men might feel, and a lot of times, you know, the passive partner might also feel that, you know, until and unless someone is just, you know, going at it, and the thirsts are something that are like very forceful. Every time you increase the force, it's going to increase your pleasure. But sometimes, again, it might be painful. And if it's painful, it's all right to stop, because it doesn't mean that that's going to give you more pleasure. So yeah, pornography is something that really needs to be addressed. It needs to be, it should not be your source of sex education, or it should not be your source of any guide towards a personal sexual life, you know.
Definitely. Someone from our audience is saying that porn is meant for entertainment and not for education. So I think they're completely
Exactly.
right. I'm glad
You
our
know,
audience is.
I don't even, do you, I mean, if, so most of us, if we watched porn, you know, sometimes there are porns that are not even entertaining, you know. Sometimes it creeps you out also, because you know, oh my god, what is happening, you know. Like, you know, you used to make, I mean, on a very casual note, I'm not like, don't catch me on it, but you know, when you were young and you see these clips, you know, sometimes you're like, oh my god, if it's like a proper heterosexual thing you're seeing, or whatever kind of, when you're talking about a passive partner and you're talking about an active partner, if it's easier to explain, you know, sometimes you feel is the person going to like kill the passive partner, you know, what is going on here, right? So that's not something that's normal, that's abnormal. So, you know, like, yeah.
Okay. So the next question that I have in line for you is that anal sex. Okay, so the anal tissues, they're quite sensitive, and experiencing pain during it is a common occurrence for many. So it would be great to tell us about your perspective about this whole.
Yeah. So, anal sex is something that was quite behind the doors and behind the curtains of, you know, some time back. People were not even discussing it with doctors. But nowadays, we see a lot of people, you know, asking questions. Even if they want to try, they first come and, so because we are fertility experts, we deal with dynamic. In fact, I've had patients who've come and talked to me about, you know, the possibility of anal sex, and even, you know, it's fairly enough. You might even questions such as, will I get pregnant if I go around anal sex, unprotected anal sex, or whatever. So anal sex is very different, you know. It's something that now a lot of people enjoy. In fact, if you are someone like, if you are, you know, like doctor nerds like me, you have to read articles and you have to read science around it. So it's something, if you read articles around it, it's becoming very, very common, and acceptance has really increased. So and people are actually enjoying it, so to speak, you know. That is also an important thing. But the only difference here is that the initial anal experience needs to be sometimes, again, it's your choice, but I feel it needs to be really taken slowly, you know, because one, your anal mucosa, which is the skin around your anus and inside your anus, is very, very sensitive, Second, it is very prone to tears, and it is very prone to injury. Third, it's also prone to increased dryness. So it's not as wet and lubricating as a vagina is. All right. And third or fourth, whatever point it is, also you need to remember anus is a source of lot of infection. All right, because the fecal matter comes out of there. So when you're talking about anal sex, these are the 3-4 points that you need to remember. One is the sensitivity of the skin, the painfulness at which it might occur. Second, the dryness around it, the elasticity which is less around it, and the probable causes of infection that go along with it. Why so? We've addressed that because the lubrication is less, the glands are less, the skin is thinner than the vaginal skin. It doesn't have as much rugosity. So rugosity is those folds, जो folds आते हैं, जो vaginal folds होते हैं, उतने folds are not present in anus. And of course, because it deals with fecal matter, a lot of infection. So what you need to take care here is when you kind of embark upon anal territory is, one, you need to be very aware that you're going to do something new. And when you're doing something new, it's important to have this communication or sign, so to speak, to let the partner know when you're uncomfortable and stop immediately, because the chances you will enjoy yourself is a little higher with anal sex. So one, you need to be very, very sure, and you need to be very clear about signals, or just vocally clear that when to stop and when it's getting to a level that's paining you. Second, we all know you use lot of lubricants. And for anal sex, again, a lot of time what you see in pornography is people use a lot of spit, but spit is not an ideal lubrication because spit dries off very easily, right? So, and anal sex doesn't produce enough lubrication. Vaginal sex mein kabhi-kabhi kya hota hai, you might use spit and it dries off, but the vagina has lubricated itself, so it's all right. But that doesn't happen with anus. So use a good lubricant, good amount of lubricant, especially for the first time. Third, of course, every time it's important, but the foreplay again is important because you need to relax yourself. Anal mucosa also has a lot of muscle, and that muscle will cause a lot of injury. So, you need to be very relaxed. You need to most of the time, you need to find the right position also to go for anal sex, because anal sex, what we've personally seen a lot of times that patients complain, or when they talk about this, there are certain positions they are comfortable with in anal sex. There are certain positions that are really not comfortable and gets very painful. So you can try a couple of positions and see where you are comfortable at. And third is always, always, always wear a protection. Most of the people make this mistake, and especially people engaging in same-sex sex, is that, they think that they're not going to get pregnant, and they kind of, stop using protection. But remember, you might not get pregnant, but you're still prone to have HIV, you're still prone to have all kinds of STIs. So please use protection. Also remember that anal sex has more chances of you getting an STI, if you're being exposed to it. Because as I said, that the anal skin, in fact, if I'm correct, it goes like 30 to 35% higher chances if you're, engaging with someone who already has an STI. Because the anal skin, the micro tears are very common. It might not bleed, but the tears are very common, and it will immediately infect you. So very important that you still wear a protection. And lastly, for anal sex, please make sure that you change your condom if you shift from an anal sex to vaginal intercourse. And that also applies to masturbation or self-pleasure. If you're using toys, or if you're using any kind of material to pleasure yourself or insert into the vagina and anus, make sure you change your condoms when you're changing your area.
Thank you, Doc, for articulating it so beautifully. And okay, so my second last question for you would be, how young people with vulvas who are having sex for the first time be sure that they don't have endometriosis or vaginismus?
Sorry, can you repeat?
Okay.
I lost it.
So, where did the question go? Oh my God, where did my question? Okay, yes. How can young people with vulvas having sex for the first time, be sure that they don't have endometriosis or vaginismus.
Yeah. So endometriosis and vaginismus are like two very different entities, right? So if you've heard the conversation and the initial part of our conversation when we were discussing that there are three types of pains that as gynacs we usually ask to come to a diagnosis. So one is the pain which happens during the uh, initial part of when you start the penetration or when you're just getting inside, and the second is a pain that is not is more, and it kind of peaks when the thirsting movement increases. So that is what I initially we discussed. So these both pain actually answers very simply your answers. So when the penetration becomes very difficult initially only, then it more points towards somewhere some degree of vaginismus. And when you have a deep-seated pain, when I say a deep-seated pain, meaning when you are in your sexual act and when the thirsting effect gives you this, peaks, usual peaks of pains every time the partner thirsts around you, then it's more of an endometriosis pain. But also there are things associated around it. Just as for endometriosis, you will also have painful periods. You might have painful uh, defecation. That means every time you go for your stool, you might have pain. You might have increased amount of pain during your periods. You might also, if you're trying and you're consequently having infertility, then endometriosis is something that becomes very common. So pain during periods, pain during intercourse, which we call as dyspareunia, right? Pain during defecation, which we know as dyschezia. So all these kind of pain are more pointing towards endometriosis. And vaginismus is like, it's an entire topic in itself. It has a lot of degrees of vaginismus in terms of its severity. But basically speaking, vaginismus could be anywhere in the spectrum, but something that is kind of, it's an involuntary contraction of your pelvic muscles to let anything enter your vagina. And it could be even a finger, it could be a penis, or it could even be a toy. So every time you try to do that, there is this involuntary closure. You're scared of it, and it causes you some kind of a pain. Then you have to think of vaginismus and get yourself evaluated before it escalates to other levels.
Okay. Thank you, Doc. I think we've covered a lot of questions in this like time. So my last question to you would be like, do you have any advice that you would like to give to the youngsters who are watching this live currently for their first time or their
Yeah, actually, I do, and I'm going to say I'm going to give something that I again said is opposite to what a lot of people keep on saying. So I feel because I see these young patients and these young people in my clinic a lot these days, or on nowadays it's more online consultations. And nowadays I think so a lot of people are talking about how to get about it. A lot of people are talking about how to have sex and how it is okay to engage in sexual activities, how it is okay, it's your choice, and a lot of other things. Somewhere kahin na kahin we are missing that small group of people who are still uncomfortable, who are still scared of doing it, and are now getting into this entire pure pressure of doing it. And when I say doing it is engaging in sexual activity. So all right, my one line message to people who are comfortable doing it, who are kind of liberated enough to not care about what is going on and independent enough to go ahead with it, more power to you. It's your choice, it's your body, explore it, enjoy it, uh, just break all the norms and taboos. All right, I don't want to tell much to them because they know what they're doing. But I want to tell to those people, also don't pressurize yourself. ऐसा नहीं है कि you are 16 and you're in college. Now everyone's talking about sex. So find someone and just have sex with the wrong person or in a wrong way. And we all know sometimes sex could be traumatic if not done with the right person, if not done in the right way. And it could, in fact, we've had cases of vaginismus where initially, it has been traced to the first encounter, which was one, not correct, the opposite person was maybe not really considerate of the person and all. So my last point is to people who have still not had a sexual intercourse, who are still not ready to have or plunge into these sexual pleasure or these activities. It's all right. It's your time to get into it is your time. It could be at 25, it could be at 21, it could be at 16. It's your choice. If there are doubts around it, luckily now you have pages like your page, and there are 1,000 other pages, authentic pages, where you can get all the answers. Or you can go to a sex counselor, or you can go to anyone, and you have doctors who are now more open to talking about it, and you can get your queries solved if it's about questions. But if it's just something that maybe you've not found the right person, or you're not just comfortable with anyone, or you just want to wait, it's all right. It's not a race. All right. So just enjoy your life and do it when you're ready. If you want to do it after marriage, well, do it after marriage. If you don't want to do it after marriage, it's all right. Everything is all right, because at the end of the day, it's your choice. Respect your choice, not someone else's choice.
Doc, you're very inspiring. Like, I just wanted to say that. And thank you so much for this conversation with us. Thank you for taking your time in educating people online. Definitely a very great and a very massive contribution you're giving to the youngsters of this country.
I'm sorry, do you want to take a few questions? फिर लोग सब मुझे डांटते हैं that I never take questions. If you don't mind.
Yeah, okay, definitely. I can read out a few questions if you want. Like, can you see the questions, or should I read out?
We can do it. Like, someone is asking, can a mother show porn to daughter just for education purpose? That's it. That's a question that I don't know the answer to, honestly. There's no answer to it. It is about what your relationship with your mother is, I would never be comfortable my mother showing me pornography, But that's my choice. Or maybe I would have been if she would have shown me. But if you have that kind of a relationship with your daughter and you feel you can go around it, yeah, I think that's great. More power to you. But I think you should point out everything that is negative in porn before and not scare her. But yeah, if you have that relationship, please. हम लोग friends के साथ देख लेते हैं, हम लोग partners के साथ देख लेते हैं. All right, I think time might have come that parents have. But I would feel that if you're talking about sex education, we have better options. You have better material, you have better resources to teach your child about sex education, and we have already discussed that porn is not the right method to teach your child.
Yes.
Right. So probably you teach them, but maybe change the material rather than using a porn.
Okay.
If someone had an injury in the tailbone around 2 years ago, it still hurts sometimes. Is it safe for that person to have anal sex? Tailbone and anal sex, yeah, it is safe. There's no issue around it. And if it was sometime, of course, what is sometime is important. Usually in these kind of injuries, your orthopedic will give you a clear-cut instructions. Just as a gynec, when I do a hysterectomy, we tell them that you cannot have sex for a month at least, because you need the skin and the vault of the vagina to heal. Otherwise, what will happen is that thirsting effect will loosen the stitches and the vagina might open up, the vault might open. So similarly with tailbone, if your doctor has will tell you that amount of time that you need to abstain, and then if they've agreed. But there's no problem with the type of sex, because you've asked about anal sex, so it's all right. I don't think that's a problem. With proper precaution, it's healthy to engage in anal sex. Yeah, great. Hindi mein baat kijiye. If vagina is small, then penetration will be painful. Correct. So that is also one of the causes of painful periods. When you say vagina is small, there's nothing called small, but yeah, you might have an agenesis of vagina, जिसमें development of vagina नहीं हुआ है. There's also a syndrome which is known as MRKH, जिसमें vaginal and uterine agenesis होता है. So these are people who will not have a uterus and who will also not have a vagina. But there are procedures where you can form a vagina, which is known as a vaginoplasty. और ये MRKH syndrome इसको बोला जाता है. So vaginoplasty will increase the length of your vagina to a level that you might have a normal sexual life. In fact, you know, we also deal in a lot of surrogacy patients. So these patients who don't have vagina, who don't have uterus, will require surrogacy. In fact, we've seen that over the years, these patients with absent vagina, when they have regular intercourse, even regularly, the length of the vagina keeps little bit increasing. So we've seen that. But there is a procedure that will increase the length of your vagina. In cases of vaginal agenesis, ऐसा नहीं है कि अभी आपको normal है and now everyone has started just wanting to increase the length of vagina. So that's not right. What type of lubricant would be better? Always, always, always use a water-based lubricant. And if you're trying for a pregnancy, make sure you don't use a spermicidal lubricant. Please use a lubricant which is not spermicidal, वरना आपको pregnancy नहीं रहती. Lubricants in that time, it's easy to penetrate without pain, I think. All right.
Okay, yes, Doc, I would just like to mention that we do not wish to exceed the certain time limit of this live. We have to post this, so you know people
Okay.
this becomes lengthy. So yeah, on that
I
note,
think
thank you. Thank you so much for taking out time and educating us about this topic. And definitely look forward to having more collaborations where you can preach and teach like audience more about their sexual health. And thank you so much.
Thank you for having me. Thank you both.
Okay,
Take
thank you.
care. Bye.
You